Welcome to MD Longevity Lab, where we're playing the long game. This is a podcast where science meets real life, with expert insights, practical tips, and real-world tools to not only live longer, but live better. Our aim is to radically change the way medicine is practiced and enable individuals to age gracefully, maintaining health span and vitality well into their later years. We're your hosts, Dr. Nisha and Dr. Vikas Patel, physicians, partners in life, and parents balancing work, wellness, and everything in between. Let's dive in. All right, welcome back to the MD Longevity Lab podcast, where we are playing the long game. I'm Dr. Vikas Patel.
And I'm Dr. Nisha Patel. We are the physician couple obsessed with helping you live longer and healthier lives without turning it into a full-time job.
Today, we are diving deep into something that's quietly sabotaging millions of Americans' health span, and that is diabetes and impaired glucose tolerance. And when I say quietly, I mean it.
Yeah, this isn't like the dramatic heart attack that gets you to the ER, though it does increase your risk of having a heart attack. Diabetes is a slow burn that steals your energy, your brain function, your kidneys, your vision.
That's right. So grab your coffee, hopefully not loaded with sugar, and let's talk about why getting your glucose game right might help you achieve that long and productive health span we're always talking about.
All right, let's start with some numbers that are going to blow your mind. Vikas, what percentage of American adults do you think have diabetes or prediabetes?
Well, let's let our listeners guess first. What do you guys think? 20%, 30%?
Well, try 50%, 50. That's over 130 million Americans, 1 in 2 adults.
And here's the kicker. Of those with prediabetes, 80% don't even know that they have it. They're walking around thinking they're fine while their bodies are slowly cooking from the inside out.
Yeah, literally cooking from the inside out. You're so dramatic, but you're not wrong. The medical term is glycation. So this is where excess glucose literally caramelizes your proteins. Think creme brulee, but it's in your blood vessel walls, damaging them and hardening them.
Exactly. Speaking of some more dramatic numbers, let's talk money. So diabetes costs the U.S. economy about $327 billion annually. That's more than we spend on the entire defense budget.
Yeah, and that really gets me fired up because it's not just the healthcare cost for diabetes, it's the human cost. Diabetes cuts 8 to 10 years off your life on average. But more importantly for us, longevity nerds, it steals even more years from our health span. And that's the number of years that we're living healthy.
Yeah. Remember our concept of the marginal decade. So that's basically that last 10 years of life. Well, diabetes doesn't just shorten that decade, it makes it miserable. We're talking about things like kidney dysfunction, where you end up on dialysis, amputations, vision loss, blindness, and who wants dementia? Diabetes is one of the number one drivers of dementia.
Yeah, and that's why in our practice, we don't wait for someone to hit that magic fasting glucose of 126 to call it diabetes. We are looking for the earliest signs of metabolic dysfunction.
Absolutely, because by the time you hit the official diabetes diagnosis, you've likely had 10 to 15 years of impaired glucose tolerance, or your body slowly losing that glucose gain.
Yeah, and when it comes to mortality, if you have diabetes, your risk of death from any cause doubles. Your risk of cardiovascular disease, it's tripled. Your risk of kidney disease, you're looking at a 10-fold increase in risk if you have diabetes.
Yeah, the scariest stat for me is probably the diabetes and dementia link. So diabetes increases your dementia risk by 60 to 70%. So not only might you not live as long, but you might not even remember the years that you do have. And that's really what type 3 diabetes is. It's diabetes of the brain.
Yeah, and before our listeners throw their phones out the window in despair, the good news is, which we always promise there's good news, this is one of the most preventable and reversible conditions in medicine.
Exactly. Unlike your genetics or your family history, glucose metabolism is something you have enormous control over. But first, we need to understand what's really going on.
All right, so let's geek out a little bit and we're going to go through some of the pathophysiology of diabetes. Because why don't you walk us through what's happening when someone develops insulin resistance and eventually diabetes?
So think of it like this. Imagine insulin is a key that unlocks your cells to let glucose in for energy. And we need glucose. That's our primary fuel source. So in the beginning, everything works perfectly. You eat, your gut releases the glucose from what you eat, and your glucose goes up in your bloodstream. Your pancreas is the maker of insulin. Your pancreas says, oh, glucose is up. Let me release some insulin so that our cells can open up and take in that glucose so that our body can either use it or store it. So blood sugar then comes back down. It's a beautiful system.
Yeah, but then life happens. We get older. We start eating more processed foods. We gain weight around our midsection. We become more sedentary and we're chronically stressed, sleep deprived.
Yeah, and slowly those cells start getting a little bit deaf to the insulin's knocking on their doorstep. They're like, sorry, insulin, I can't hear you, knock louder.
The pancreas is like, fine, I'll make more insulin. I feel like the pancreas is kind of like the wife, holding the bag. And for years, sometimes decades, this works. Your blood sugar will stay normal because you're just flooding your system with insulin.
This is kind of where it gets insidious. So your standard fasting glucose test, it'll still be normal here. Your doctor says you're fine, but your fasting insulin might be sky high. It can be 1.5 times normal, 2 times normal, and nobody's routinely checking that number.
Yeah, we refer to this as the hidden years of diabetes. You look fine on paper, but internally that high insulin is wreaking havoc. It's promoting weight gain, especially around the midsection and belly. It's causing inflammation and it's making your blood pressure go up.
This is kind of the kicker. High insulin actually makes your cells more insulin resistant. It's like this vicious cycle. The louder the insulin knocks, the more the cells want to ignore it.
Yeah. And eventually the pancreas gets exhausted. It's been working overtime for years, pumping out insulin like crazy. And those beta cells, those are the cells in the pancreas that make insulin. They start to burn out eventually.
And this is when your labs start showing that your blood sugar is going up. So first you hit prediabetes. Your fasting glucose goes up above 100, somewhere between 100 and 125. Your hemoglobin A1C, which you guys have heard us talk about previously, it starts creeping up past 5.6. So 5.7 to 6.4 is that prediabetes. And then eventually your fasting sugar hits 126 or your A1C hits 6.5 and we say you have diabetes.
Yeah, remember, this isn't a switch that flips overnight. It's a slow slide that's been happening for years, which is why I get very frustrated when patients come to me and say, Doc, I just became a diabetic last month. Like, no, you did not just become a diabetic last month. This has been brewing for years.
Right. You didn't just become a diabetic. You finally hit our arbitrary cutoff that we use for diagnosis.
Yep. Now let's talk about what this high glucose actually does to your body, because this is where the longevity piece comes in.
Yeah. So you had mentioned glycation earlier. So glucose is essentially caramelizing the proteins, and this happens everywhere in your body, and specifically the areas that have the most blood flow. So the blood vessels become stiff and damaged. Your kidneys, which have a huge amount of blood flow, they start to get scarred. The tiny blood vessels in your eyes start to get damaged. Same is true of the blood vessels in your heart and brain.
Yeah, it's like your body is aging in fast forward. So all these processes that are normally happening slowly over decades are accelerated big time when you're bathing in issues such as excess glucose and diabetes.
And then there's kind of this inflammation component. So high glucose triggers these inflammatory pathways through your body. And you've heard of us talking about measuring CRP, and that's one of those measures of high inflammation. So chronic inflammation is basically the gasoline that fuels most of the age-related diseases. So that includes heart disease, cancer, Alzheimer's, arthritis.
Yeah, and There's something most people don't know. Diabetics have compromised immune systems. That's why they get more infections, their wounds heal poorly, and that's why COVID hit the diabetic population so hard. Additionally, for patients that are diabetics and getting surgery, their recovery is so much slower.
That's right. Wound healing just doesn't happen as efficiently, mostly because they have those high inflammation in their body at baseline. The brain piece is huge too. So your brain is incredibly glucose sensitive. When you have these wide swings in blood glucose, your brain function actually ends up suffering. And this is when people start complaining of things like brain fog, mood swings, chronic fatigue.
Yeah. Some researchers actually call Alzheimer's type 3 diabetes because of how closely linked insulin resistance and dementia are.
Okay, so we've painted a pretty grim picture here. Here's the thing. Every single step of this process is reversible if you catch it early enough and make the right changes.
And the best part is you do not need expensive medications or procedures. The most powerful interventions are lifestyle based. But before we get on to what lifestyle interventions work, let's talk about how to actually know if this is happening to you.
Exactly. So, Nisha, you mentioned that the standard testing kind of misses some of the early stages. What should people actually be asking their doctor for?
Great question. So the standard panel most doctors order is a fasting glucose and maybe a hemoglobin A1C, which is that 3-month report card for what your sugars look like. And that's like trying to understand a movie by watching the last 10 minutes.
Exactly. By the time fasting glucose is elevated, you're already well down that path of diabetes, and we really want to catch it earlier, right?
Here's our go-to metabolic panel that we order on every patient. And first is fasting insulin. So this is a smoking gun that most doctors don't check.
Your fasting insulin, ideally should be under 5. If it's over 10, then we know that you're already insulin resistant. We are typically counseling patients when they're in between that 5 and 10 that, hey, this is something that we need to pay attention to moving forward and institute some of those lifestyle modifications.
And even if your insulin is elevated, you can have a completely normal glucose and hemoglobin A1C, right?
Correct. Yeah. So the idea is that if your fasting insulin is somewhere in that moderate zone, you're exactly right. Those numbers will be normal for hemoglobin A1C and fasting sugar, but this is one of those early signs that you have some impaired glucose tolerance.
Another key biomarker that we track for diabetes risk is visceral fat. And that's that radioactive fat that surrounds your internal organs. And some studies show that people with high visceral fat levels have up to 2.5 times greater risk of developing type 2 diabetes. And this is independent of their total body weight. So that's why measuring visceral fat with a full body DEXA scan is so valuable. It tells us far more than the scale ever could.
We also love to check triglycerides to HDL ratio. So you take your triglyceride level and divide it by your HDLs. You want that ratio to be under 2, ideally under 1.5. When it's elevated, it's also typically a good marker for insulin resistance.
Yeah, and your doctor should be routinely checking for your hemoglobin A1C. And many of you have heard of this. This measures your average blood sugar over the past 3 months. But we don't like waiting until it hits the pre-diabetic range of 5.7. We want to see this number under 5.5, ideally around 5.2. So we have patients that have been told that, their hemoglobin A1C is normal. Normal doesn't necessarily translate to optimal.
Exactly. So here's something that most people don't know. You can be thin and still be very insulin resistant. And I think we've talked about this previously. This is that concept of being skinny fat or metabolically obese despite having a normal weight.
Exactly. We've seen marathon runners with terrible insulin sensitivity because they're eating a high carb processed diet and have low muscle mass. I was one of them.
Speaking of muscle mass, muscle is your glucose disposal system. The more muscle you have, the infinitely better you actually handle carbohydrates.
Yeah, for our tech savvy listeners, continuous glucose monitors are another really neat tool. So, CGMs aren't just for diabetics anymore. We love having patients wear one for a couple of months to see how different foods affect their blood sugar.
It's super eye-opening, right? You might think you're eating healthy, but then you see that your healthy smoothie, for instance, spikes your glucose to over 200.
Yeah, or you discover that your blood sugar crashes a couple hours after meals, which explains why you get hangry and crave more carbs.
The other thing CGMs show is this thing that we call the dawn phenomena. So many people wake up with elevated glucose even before they've had anything to eat. And that's basically your liver dumping glucose overnight, usually due to insulin resistance or stress.
So, when should you get tested for diabetes? If you have any family history of diabetes, if you're carrying a little bit of extra weight around your midsection, you're feeling groggy after meals, you're having brain fog, definitely our patients going through perimenopause, that's a big one. If you're having sugar cravings,
Yeah, I think it's, anyone over the age of 35 should kind of know these numbers. And then they should be checked routinely. This isn't just for people who are obviously at risk. Remember, 80% of people with prediabetes just don't even know that they have it yet.
yep. And our female listeners, remember, pregnancy is a stress test for your glucose metabolism. If you had gestational diabetes, you're at much higher risk later in life to get prediabetes and diabetes. I know with one of my pregnancies, I had gestational diabetes. We would go out to these diners and I would order full on pancakes, omelet, side of sausage, and that was my first pregnancy. I fully was eating for two. The OB would be like, you can stop gaining weight now. And I would just take it as a suggestion and be like, cool, I'm going to Chick-fil-A next. Thanks.
That was fun.
Yeah. That was a fun pregnancy.
That was a fun
Yeah.
pregnancy. All right. So remember, these labs are complex and they take time to go through. So it's good to have a meaningful relationship with your physician so that you're not rushed in just a 10-minute visit.
I think it's also important to have a realistic expectation of what insurance will cover and won't cover. So some of these tests may go towards your deductible. Even though in the longevity space, we consider them preventative and proactive, insurance doesn't always see it that way. So, these are important tests. We've decided to budget for ourselves, just like we budget for our groceries, our rent, our car payments. We've budgeted some amount of our income that's being devoted to taking care of ourselves and being healthy.
Let's talk a little bit about how we start to fix these numbers. Here's a thing that gives me so much hope about diabetes and prediabetes. Lifestyle changes are more effective than medication in preventing and reversing the early stages of this disease process.
The diabetes prevention program showed that lifestyle changes reduce diabetes risk by 58%. Whereas metformin, which is a medication, it's the most prescribed medication for diabetes, it only reduced A1C by 31%. So that really tells us that lifestyle measurement is golden.
And we're not talking about extreme measures here. The participants of that study lost just 7% of their total body weight and exercise 150 minutes per week. That's the government's recommendation is 150 minutes of exercise a week. That's it.
Yeah. So let's start with nutrition because this is where you get the biggest bang for your buck. And I'm not going to tell you to eat keto or go vegan or whatever the latest fad is. The key to stabilizing your blood sugar is protein. Protein helps stabilize your blood sugar and it makes you feel full for longer. So I know I aim for about 25 to 30 grams per meal. It's hard to do. I remember feeling like, how am I supposed to get 100 grams of protein a day? And it's a gradual process. I think it took me a full 6 months to a year to really get it right.
Yeah, this is not something you have to get right overnight, right? And it does require a little bit of planning beforehand on how you're going to get that increased protein intake. Protein keeps us full longer. And for every gram of protein that we're eating, only 3/4 of that gram of protein is netted in calories to our body because it costs us more to process it, as opposed to 100% of that gram of fat being netted to our body and 95% of that gram of carbs being netted to our body. So that's why you hear so many health experts promote protein, especially if you're trying to do something like fix insulin resistance. So rule number 2 is fiber is your friend. It slows down glucose absorption and it feeds the good gut bacteria, which we need to help us digest. So vegetables, nuts, seeds, legumes, those are all huge fiber sources.
Rule number 3, timing matters. We love the saying, eat breakfast like a king, lunch like a prince, and dinner like a poor person. Your insulin sensitivity is highest in the morning and lowest at night. So avoiding big meals after 5 p.m. is important. And I know most of you that are listening that are over 40 can attest to this. When you eat a big meal after 5 p.m., it still feels like it's in your stomach in the morning. You've got brain fog. You haven't slept well. And that's because of the insulin sensitivity that declines throughout the day.
Exactly. And then another big one is please try not to drink most of your calories. Right. So liquid carbs hit your system very quickly and very hard. That includes fruit juices, sports drinks, fancy coffee drinks, sodas. I know you'll hear us say that we're drinking fruit smoothies. As a breakfast substitute, we tend to have protein smoothies in the morning. And when you actually look at how much sugar is in them, it's really only 100 calories of carbs, but we're getting 50 grams of protein in that. And so the makeup of that fruit smoothie is natural sugars from fruit. It's not supplemented sugar. And it's a little bit different than if you're just drinking Coca-Cola.
Yeah, I have patients who think they're being healthy drinking fresh pressed green juices or doing a juice cleanse because of the wording, the marketing that it's a cleanse, it's good for you. But doing a juice cleanse, you're getting 30 to 40 grams of pure fructose with no fiber to slow it down and no protein. I tell them, do a juice cleanse and wear a CGM. And it's all over the place. And the only reason they might be feeling good is because they're calorie restricting, but all of the calories they're getting are in the form of carbohydrate.
Juice cleanses are basically useless from a nutrition perspective. The only reason they work is that you're in a severe calorie restriction, right? The calories you're taking in are basically all sugar, but you're only getting maybe 1,000 calories in a whole day. And then you're in a deficit. If your average caloric intake somebody needs is 2,000 calories, that's why they're losing weight. There's no detoxification happening. You're just in a calorie restriction diet. So what specific foods should we be avoiding? There's a bunch of obvious ones, candy, soda, baked pastries, but we also need to be careful of the things that are marked healthy, right? Like dried fruits, granola, certain smoothies, even some protein bars, depending on what the makeup of those are.
Yeah, the glycemic index can be helpful when making your food choices, but we like to teach people to look at their plate. Half of your plate should be non-starchy vegetables, a quarter of it should be protein, and a quarter of it should be complex carbs, something like a sweet potato or quinoa. And obviously, this isn't a perfect world. Like there are many nights where our plates look nothing like that. But, if we have that as the goal, then we know, okay, most of those nights we got to check off that box.
Totally. And a little bit of a tip here, eat your vegetables first. Studies show that eating salad or vegetables before your main course can reduce your glucose spike by 20 to 30%.
So let's talk about exercise because this is where the magic happens. Muscle, we've talked about it, that's your glucose disposal system. And when you contract your muscle, it pulls glucose out of your body without needing insulin. I know I put on a couple pounds of muscle and my resting metabolic rate went up. So I'm just able to ingest more food or have that extra glass of wine guilt-free.
Yeah, this is pretty much why I tell, all of our pre-diabetic patients that you finish a meal, you go for a 10 or 15 minute walk because it's naturally without insulin, allowing your muscles to pull the sugar out of your meal and utilize it right into the muscle tissue.
But for long-term insulin sensitivity, you need both cardio and strength training. So cardio helps with immediate glucose disposal, and strength training builds a muscle that serves as your glucose storage tank.
We recommend to all of our patients that 150 minutes of moderate exercise per week, plus 2 to 3 strength training sessions. If you're starting from zero, even 10 minutes of exercise after a meal makes a huge difference.
Yeah, and sleep, let's not forget that. That's hugely overlooked. One night of poor sleep can make you as insulin resistant as a type 2 diabetic. So we want to aim for between 7 and 9 hours of quality sleep. I know when I wore a CGM on the nights where I slept poorly, the entire next day, my glucose was in the pre diabetic range. So it was pretty eye opening to see the direct effect of poor sleep.
I noticed the same thing after working night shifts in the ER, that my glucose was all over the place after the night shift. Even if I come home and I sleep for 6 hours, my glucose is never the same as it is after normal nights of sleep. I think we mentioned this earlier also, right? Stress management is a big one here. Chronic stress does keep your baseline cortisol levels somewhat elevated and does actually promote insulin resistance and storage of belly fat.
Because can we touch on some of the research with intermittent fasting?
Yeah. So intermittent fasting can be pretty useful for patients. If you think of it this way, you're giving your insulin in your body a break for 12 to 16 hours. So intermittent fasting or time restricted eating, you're not eating for a majority of the day, and then you're fitting in all of your caloric needs into a shorter window, whether that be 6 hours or 8 hours. And if you think about what's happening with your insulin levels are going to stay pretty stable through the whole part of the fasting day. And then they're only going up when you actually start to eat.
So here's some practical tips for our listeners. We want you to start tracking how you're feeling after meals. If you're getting sleepy, bloated, or craving more carbs a few hours later, that meal probably spiked your blood sugar.
The other thing is, meal prep. When you're hungry and unprepared, you and I both know this, we make poor decisions when we're hungry. If you have a little bit of meal prep done beforehand and you have your go-to snacks of protein or vegetables, then you're much more prepared. And when those hunger spikes come, you have something ready for it to grab instead of making the poor choice of grabbing the donut.
Oh, for sure. And we've grabbed the donut. It happens, but it's much easier to have it already there because you don't even need to think about it. And we encourage our patients, don't try to change everything all at once. Pick 1 or 2 things to focus on first. Maybe it's adding protein to your breakfast or taking a walk after your meals. Rome was not built in one day, and your metabolic health isn't going to be fixed in a week. This is about building sustainable habits that you can maintain for decades.
Yeah, the cool thing here is that your body responds really quickly to these minor changes. And so many of our patients will see improvements in their energy and subsequently their blood sugar literally within weeks of making some of these changes.
Absolutely. And for those who need some extra help beyond lifestyle changes, we have some incredible medications that can complement these efforts. So, Vikas, let's dive into some of the medications that we use for diabetes.
Yeah, so pharmaceuticals are not evil. Like while we always promote the lifestyle and diet changes, there are patients who are going to need pharmaceutical help. And I want to be clear, lifestyle changes should also be concurrent with going on medications. But for some people, the medications are a powerful tool.
Exactly. We always start with lifestyle, but sometimes people need the extra help to break the cycle. It's not cheating to go on a medicine and do the lifestyle modification concurrently, especially if you had diabetes for years and your pancreas is struggling. Why not get some help?
So the old faithful first kind of line treatment has always been metformin. And it's been around for decades. It's cheap. It's, $3 or $4 for a month's supply. It's generally pretty well tolerated. There's a little bit of a GI cramping thing in the first couple weeks, but then that goes away. And there's tons and tons of evidence that show that it does lower hemoglobin A1C. And there's even some evidence, though we're not 100% sure yet, that it may actually have some anti-aging benefits as well.
Yeah, metformin works primarily by reducing the amount of glucose that your liver dumps into your bloodstream, especially overnight. So it also can make your muscles more insulin sensitive.
One of the cool things is that metformin does not cause low blood sugar, so you can take it safely without getting hypoglycemic. And it also does not cause weight gain, like some of the older medications. It actually, most patients tend to lose just a little bit of weight while they're on metformin.
So the real game changer in diabetes the last few years have been the GLP-1 receptor agonists. I'm sure everyone has heard of this.
Everyone has heard of Ozempic, right? And thanks to celebrities and social media, I don't know anybody who hasn't heard of it. These drugs have legitimately completely revolutionized diabetes care.
Yeah, let's talk about how they work. So GLP-1 is a hormone that your intestines naturally release after you eat. So this tells your pancreas to release insulin, but only when your glucose is elevated. It also slows gastric emptying, which signals your brain that you're full. So many patients that are on a GLP-1 agonist will eat a little bit, but they'll feel full for hours after.
The beautiful thing here is that they work with your body's natural systems. They don't force insulin release like some of the older drugs. So there's not this risk of dangerous low blood sugars. And the weight loss effects are substantial, right? People can lose 15, 20% of their body weight on average. And that's pretty analogous to surgical level interventions like gastric bypass or gastric sleeve. But what really excites me about these drugs is that they concurrently have these cardiovascular benefits beyond just reducing your blood glucose and improving weight loss. We see these huge reductions in things like heart attacks, heart failure, strokes, and even kidney disease.
Yeah, the studies are showing 20 to 30% reduction in major cardiovascular events. That's huge. And there's emerging research suggesting that they might even help with fatty liver disease, sleep apnea, even addiction. So we've had some of our patients that are on GLP-1 say that they've been able to cut down their alcohol intake or they've quit smoking. So we're not quite sure how those pathways work, but it seems like a game changer.
There's definitely some centrally mediated process going on in the brain that's I think netting some of those addiction benefits. So the medications are not without side effects. It's worth mentioning that the most common things are really the GI effects. So they do cause nausea for people. There are patients who will get vomiting a little bit less commonly. Patients will complain of some diarrhea. Usually the worst of that occurs right off the bat, and it occurs if people go on a moderate or high dose too quickly. We always recommend with our patients to start very low and gradually over the course of months increase dose.
And I think it's important to note to stay on the lowest effective dose of that GLP-1. So even if you're reducing your weight slowly, we'd rather have you on a low dose, low side effects, and have you incorporate the lifestyle modifications like upping your protein, getting your strength training in conjunction with your GLP-1, not just relying on the GLP-1 for your weight loss.
Yeah, and it's also worth noting that these drugs are not inexpensive, right? Uh, they can cost upwards of $800 to $1,200 a month, depending on which medicine it is. Though now with some competition in the market and bad press, I'd say the prices are starting to come down a bit. Also worth noting, another class of drugs that I'm pretty excited about is the SGLT2 inhibitors. So these are drugs like Jardiance, Farxiga, and they actually work by having your kidneys excrete sugar into your urine. So yes, you're literally peeing out sugar. I know that kind of sounds weird, but it's actually quite elegant. You're removing glucose from your system without relying on insulin at all, much like how GLP-1s have benefits beyond just glucose control. The SGLT2 inhibitors have been shown in a bunch of studies to be very cardioprotective and kidney protective. So people are losing weight on these drugs also because they're literally peeing calories out in their urine.
Yeah, and there are some newer drugs that affect both the GLP-1 receptors and the GIP receptors. And The brand name is Mounjaro, and these are weight loss and diabetes control medications. They're even more impressive than the GLP-1 agonists. And the studies are showing about an average weight loss of 22 to 25% of total body weight at its highest dose. And that's unprecedented for a medication. That's higher than even some surgical interventions. But here's my philosophy on all of these. These medications are tools. They are not cures. They can help you get your metabolism back on track, but you still need to address the root causes, which are sedentary lifestyle, poor nutrition. So if you're on a GLP-1 drug, but you're still eating processed food and not exercising, you're missing the bigger picture. These drugs work best when it's combined with those lifestyle interventions. And many people fixate on the number on the scale, but that doesn't tell the full story. GLP-1 medications, you're not just losing fat, you're also at risk of losing priceless muscle. And we know that the muscle is a metabolic engine that drives your metabolism and allows you to burn more. So without protecting muscle, it becomes a recipe for weight cycling. And that's why we emphasize prioritizing weight training and adequate protein intake and getting your full body DEXA scan, right, to track your muscle.
Yeah, for our longevity focused listeners, here's something interesting. Some of these newer diabetes drugs might actually slow some of the aging clocks and at a cellular level. And there is actually some research looking at their effects on inflammation, autophagy, and telomere length. But to Nisha's point, I think we try and do a pretty good job in counseling our patients about the lifestyle modification along with the GLP-1 and GIP drugs, because if you're 40 years old and you're a little bit under-muscled, you probably still have enough muscle tissue that having an aggressive weight loss won't necessarily cause long-term problems. But if you're 50 or 60 and you're on these drugs and you're losing fat and muscle, you're going to have a very real world consequence of that decreased muscle strength. And that means falls. It means that your body cannot actually dispose of glucose the way that it's supposed to if you go off of that medicine. And so the strength training aspect and making sure that you're keeping up with protein intake when your appetite is suppressed is key to making sure that you have long-term success while you're on these medications.
The key takeaway, I think, is that we now have more options than ever when it comes to diabetes, whether it's lifestyle changes alone, which we've had many patients be successful with, adding metformin or some of these newer medications for advanced cases. There's a path forward for everyone.
Unlike 20 years ago when diabetes was just considered progressive, irreversible. Now we know that with the right interventions, people can actually completely reverse their diabetes risk. So let's have some real talk here for a minute. Nish, we talk a lot about diabetes prevention, but we haven't always had perfect numbers ourselves.
I will own this one. I was not a diabetic, but I was definitely metabolically unhealthy. And being of South Asian descent with diabetes running rampant in my family, I didn't just want to be a sitting duck.
On the outside, let's face it, you look perfectly healthy.
Good answer.
Ideal.
Optimal. Exactly. But when I dug into my labs, there were some numbers I needed to address. So it was a huge wake-up call for me that looking healthy doesn't always mean you're metabolically healthy. For me, that meant rethinking some habits. I had to cut back on snacking and late night sweets. I still enjoy my late night sweets, but in moderation. Yeah. And I had to start prioritizing protein at every meal. And I leaned into strength training too, which I never really enjoyed. And for me, I've never had a huge problem in the sleep department. I will say it's gotten harder with perimenopause, but I've got my weighted blanket, my eye mask, and my sound machine, and I'm out now.
I should take a picture to post on our website of what you look like on that.
I'm like the poster child for good sleep.
But, all those changes work for you, right? And your lab numbers shifted, your DEXA scan results shifted.
And one of the most eye-opening tools for me was wearing a continuous glucose monitor, a CGM. So it showed me exactly how my body responded to certain foods and drinks that I thought were healthy. Some protein bars that I was eating was spiking my blood sugar like crazy. And then I'd look on the label and be like, oh, cool, this is 6 grams of protein and like 40 grams of carbs. Of course, this is spiking my blood sugar. But I did learn a fun fact. It turns out my blood sugar likes tequila way better than wine. So I learned that I can still indulge once in a while. I just have to be smart about what my body can actually handle.
Small wins.
Yeah, for sure.
This is kind of the power of data, and it's helpful when you don't have to guess what's going on and you can actually see what's working, what's not working for you.
Yeah, and it makes prevention so much more doable and personalized when you're seeing these metrics on you, right? This isn't something you're reading in a paper or listening to on a podcast. You're seeing your data real time.
And I think this is why we're so passionate about the early detection and prevention component of all this. Diabetes doesn't happen overnight. And it's helpful to know what all these warning signs are to look for.
The other thing that really motivates us is seeing patients reverse their diabetes. We've had people come in on all these medications and they've been able to drop 50, 100 pounds and completely transform their health, sometimes get off all medications, and they're also motivated. We've also had patients that have a normal A1C, hemoglobin A1C, normal fasting glucose, and we do their longevity testing and they're metabolically unhealthy. So they have a sky-high fasting insulin, and they're given this wake-up call of, if you don't change this, you are on a road to diabetes. And those patients have turned it around in a year and have completely escaped.
Way less than a year, right? Like we usually will retest those patients 4 to 6 months later after these diet and lifestyle modifications. And then we'll see that their fasting insulin level goes from 13 or 14 down to 7 in just that short amount of time.
It does require commitment. There's no magic pill. And even with these new amazing medications, lifestyle is still the foundation for diabetes prevention. It is never too late to start. So we've had patients in their 70s make huge strides.
Totally. So let's kind of wrap this up with a few action steps and takeaways. If you take nothing else from this, here are kind of the things that we would want you to do. So number one, get to know your numbers. Get a comprehensive metabolic panel, including your fasting insulin level, not just your fasting glucose. Get a hemoglobin A1C. If you can, get a DEXA scan done so that you know what your visceral fat is. Yes, you may have to go direct to consumer for some of the testing if your physician can't order this, but please check with your physician on what they can order. These are not prohibitively expensive tests to get done, and it is worth your time and saving a little extra to get these numbers.
Many physicians' hands are tied when it does come to insurance, so it's important to note health insurance doesn't always see it as preventative. It's in their best interest to save money. It's a for-profit industry. And at the end of the day, we're in charge of our own health. So, many of these tests do go towards our deductible, even though they're considered preventative or proactive. And that doesn't mean you don't get them. It just means, just like we would buy a gym membership because it's good for our health, we have to allot that in our budget, that we have to build in some of these costs if we want to take care of ourselves.
Number two, start with one small change. Maybe it's just making sure that you're getting enough protein in with your breakfast. Maybe it's that you're going to take a 10 or 15 minute walk after dinner, but pick something that you know is sustainable for you. And then once you're doing that one thing, then you can add on another thing the next month.
Number three, pay attention to how you feel after meals. If you're getting sleepy, groggy, craving more food after a few hours, that meal probably spiked your blood sugar and is not serving you.
That's right. Or if you feel like you can't move for the next 4 hours after your meal, you ate too much.
Yeah, that was us Saturday night.
Number four, build muscle. Right. This is the best glucose disposal system that we have. You don't need to become a bodybuilder, but some form of resistance training 2 to 3 times a week, just 30, 35 minutes a session is crucial. It will pay you dividends in the long run in multiple forms, but one of those is to get rid of blood glucose.
Number 5, prioritize your sleep. One bad night of sleep can make you temporarily insulin resistant. So we want to aim for 7 to 9 hours of good quality sleep.
And remember, this isn't about perfection. It's about progress. So small, consistent changes compounding over time.
Yeah, the stats we shared at the beginning are pretty scary. I know we were alarmed when we heard them, and we're doctors. So many of you listening are like, wait a minute, this is a big problem. But they don't have to be your reality. Diabetes is largely preventable and often reversible if you catch it early.
And remember, let's kind of think about that concept of marginal decade, right? Those final 10 years of life. Do you want to spend them dealing with complications from things like diabetes, or would you rather be hiking, playing with your grandkids, traveling? The choices that we're making today about our glucose metabolism really determine which version of future you get.
So if this episode resonated with you, please share it with someone who needs to hear it. Diabetes affects so many of our families, and early prevention is key.
Remember, we're here to bridge the gap between reactive medicine and proactive health optimization. Your future self is kind of counting on these decisions that you make today.
Until next time, keep playing the long game.
Thank you for listening. Thank you for playing the long game with MD Longevity Lab. You can visit us at www.mdlongevitylab.com to learn more about how we can support you on your journey. Stay connected with us on social media at MD Longevity Lab for tips, updates, and behind-the-scenes insights. If you enjoyed today's episode, we'd love it if you subscribed, left us a rating, or shared it with someone you know who's also playing the long game. Thanks for listening. We'll see you next time.